They invited us in for a cup of tea and a chalky biscuit, knowing my weakness. But we said, why don't you come down and have a chat with us? And, well, they have. And what would people in the area do without people like Margaret and shop volunteer Iris? You're very welcome, both of you.
Thank you. Right.
Thanks for coming down. How's the shop doing?
Fine.
Fine?
Yes.
Oh, and what kind of things? A bit of everything, I suppose, is it?
Well, we're doing very well, actually.
Yeah.
We sell all sorts of things, bric-a-brac,
Yes.
books, ladies' clothing, men's clothing,
Right.
shoes, children's wear, children's toys. There's quite a wide array of things that we sell.
Have you had an unusual donation at all?
Well, Iris has been there longer than I. Can you remember any?
Are you thinking of the wooden leg that came in?
No, not really.
Oh, that was from my past experience.
What was it?
We
Somebody
offered
brought
a
wooden
false
leg
leg. Well, they offered to donate a false leg.
Yes. Did you read about that health authority in England the other day who had a kind of a search for old implements that had gone out, from hospitals and so on? Zimmers, crutches, and they found Zimmers drying clothes in various houses and so on. Crutches were in props for various theatre productions of Treasure Island and many things. It's quite incredible. And Iris, how long have you been volunteering now?
14 years in
14
October.
years. Were you volunteering somewhere else before? Are you a natural volunteer, as it were?
Well, my husband died 15 years ago this year, so I thought, well, rather than sit around feeling sorry for myself, I would rather get up and do something for someone else.
It's a social thing as well, isn't it?
Yes.
Yes. Okay.
Yeah.
People come in for a chat, I bet.
Yeah.
Yeah. And of course, charity shops in the old days. I've got to say this very carefully, but people used to sneak into charity shops, and they say they were pushed for money, whatever. But now we've moved on a bit, haven't we?
Yes.
Ooh, you can get posh shops down now.
Yeah. Our standards have improved quite a bit.
Yeah, woman wears a dress one night, gone.
It is the right place to come for a bargain. You can get some real bargains in these places.
Yeah, I'm sure.
Especially in our shop.
And you enjoy it all?
Very much.
Well. How successful is the shop now at raising money?
It's very successful.
Good.
Yeah, and getting more and more so. The stronger the team is becoming, the more successful, obviously, the shop will be.
And what are the community? Very supporting, I suppose.
Oh, yes. Yeah, they're very good, very kind.
Yeah, quite.
Yes.
Isn't it extraordinary? I mean, I'm not saying this unkindly as well, because I come from a kind of background, the same kind of background. But areas which are perceived by others to be hard areas, where people possibly are out of work, and people have health problems and so on. It's those areas. If you go around looking for charity money, those are the areas that give most.
Yes, I agree. Yeah.
It's extraordinary, that. Well, give my regards to everyone working there, Margaret and Iris, and many thanks for coming down. And my good luck to both of you.
Thank you very much.
Wales, that was BBC Radio Wales. It is now Roy Noble here in Tredegar in Bedwethley House, let me tell you, celebrating in Erin Bevan and the 60th birthday of the NHS. And if the last choir had difficulty standing, they could send for district nurses. They've got two, Carol Jones and Sian Parnell here, and a lovely chat we're having as well. I suppose illnesses have changed now, haven't they, over the years? What you see mostly.
Yes, I mean, early diagnosis now.
Yeah.
Patients coming out of hospitals far earlier. They could be in hospital 10, 14 days after surgery.
Yes.
Now, 2 or 3 days, they're home.
Yeah, quite. Sometimes, people come home, have had an operation, they weren't quite sure all the details of it, really. It's just
no.
Yeah. They just have an operation.
That's right. I mean, the older generation, they were in the hands of the doctors, and they whatever the doctor said went.
Yeah, quite. And people are living longer as well.
Yes, they are.
Yeah.
With the good care that they're getting from the NHS.
Yeah.
But yes, they are living longer.
What about the equipment that you have then? Is there constant training, updating? I suppose that must be.
Always.
Yes. Yeah. And what about the people's health then in Tredegar? Because you're often said, it's mentioned in the phone in this morning about, being a deprived area in terms of health, and more instances of bad health in areas like Blaenau.
And we're still seeing that. We're still seeing the residue of the effects of the heavy industry and the mining and the ironworks, etc., with the chests and the coronary heart disease.
Still there.
It's still there, yes.
Yeah, quite. What about, I don't know, I may be imagining this, but, you get more instances of, say diabetes now, or is it just picked up and it wasn't before?
Well, no, yes, the technology is there today, so the coronary heart disease, the diabetes, the cancers are picked up earlier.
Yeah, quite. Yeah, and relationship with patients then, as I said, you've indicated that, it becomes very, very close, doesn't it?
It is, yes. Yeah. In the home environment, you do get very close to the patient and their family. often, you know, if you're on holidays and you've been nursing someone, and you know while you are away that there's a possibility that they may pass away.
Yes.
I mean, we phone in, we asking how they are. You know, it's almost as if, you know, you're leaving a member of the family sometimes.
That's right. And of course now, under more pressure because of things like health and safety, you know, new risks and so on.
Yes.
Be careful what you do.
But we've got the extra equipment these days that, like years gone by when Carol and I first started, we'd be lifting patients, etc. But now we've got hospital beds in the home, we've got hoists in the home, etc. So yes, we're very safety conscious.
Yeah. And at Christmas, of course, an indication of how close you are to the community. You act as posties as well.
Oh yes, definitely.
Yes. Take a poster on the Christmas.
Yes, not that we tell patients that who we're visiting, naturally through confidentiality, but Tredegar's a small town, you know, they know that we're visiting Aggie and Trevel, etc. So yes, Christmas time, let's take the Christmas cards up. Yeah.
Well, I know you got a dedication for a moment, but let me just say, Sian Fennell and Carol Jones, many thanks to you. And can I underline the fact that people might like to know that in all things considered on Sunday morning, Roy Jenkins will be looking at the relatively new concept to Wales and the UK of parish nursing, a system of whole-person healthcare through the local church, that is. And that's all things considered on a Sunday morning at 8:30 here on BBC Radio Wales, and very relevant now for the NHS. You've got a dedication there, haven't you?
I have, yes. I would like to wish Nairi Owen a happy birthday for tomorrow. She was the first person born under the NHS 60 years ago, and the midwives who delivered her actually named her Nairi after a Nairon, and Jennifer after Jenny Lee.
Good grief.
An Iron's
Wasn't that marvellous?
Yes.
So happy birthday to her.
Yes.
The first freebie, as she called herself.
It was the first
She was the first freebie under the
out of 8
NHS.
children in the family.
Oh, well, Carol and Sian, many thanks to you, and a birthday wish to her too.
Yes.
Congratulations.
Thank you. Thank you.
The Circle, just up the road. A group are working away, helping people to get fit, healthy, and have a bit of fun as well. With me now is Nick Toulson, manager of the Feeling Good project, and also Michelle Jones, who's a member from Tredegar. Good afternoon to you both.
Good afternoon.
You've been off sick for 3 days, haven't you?
I'm a good outlet for a health project.
Overdoing it, see? Overdoing it. And you'll probably let your vest go a month too early. That's the kind of thing. This weather we're having here. How did this all come about now, then, this organisation?
It started a few years ago. Tredegar Development Trust and the Bavarian District Development Trust and the Communities First areas looked at getting together a health project to try and find better ways of benefiting the health of local people in the area.
Yeah. And anyone can join in?
Anyone can join in, yep.
Yeah. Did you get a grant for it?
Yeah, there was a grant from the Big Lottery Fund worth £572,000.
How much?
£572,000 to run the project over 3 years.
Yeah.
And it works with people in the Tredegar and Ebbw Vale areas.
Yeah. And you work in specific communities, as you suggested then?
Yeah.
Tredegar, Ebbw Vale, and so on.
Yeah, it's linked to the Communities First areas.
Yeah, yeah. And Blaenau Gwent, I mentioned it once or twice already, not only Blaenau Gwent, but one or two of the heads of the valleys, local authorities, have got high instances of, well, you know, low levels of good health.
Yeah, there's quite a few sort of high instances of poor health in this area, and as you mentioned, in other areas as well.
Yeah. How are you working to change that now?
We're trying different ways, really. The Feeling Good project is trying to get people exercising in a nice, easy way. Looking at walking, cycling, environmental activities. Being outdoors is a very, very natural environment to be in, and can benefit a lot of people in lots of many ways.
Yeah.
But we're also looking at food and nutrition, so teaching people how to cook cheap, healthy meals, and there's activities for older people and carers, so getting older people active in very easy ways. But we've also got an element of health awareness about the project, so giving people information or letting them find the right information so they can make decisions about their health.
Yes.
And improve it that way.
Are you working, you know, in conjunction with the NHS or alongside them?
Yeah, we're working with the National Public Health Service team, and a lot of the research was done by the local health board as well.
Yeah, yeah.
So it's very much a partnership project. The local council as well with their Healthy Living project as well. Links.
You don't come across this American team of Think Fit. You can sit in an aggressive way. And as long as you think you're getting exercise, you're doing yourself a
I haven't come across that one. I'll have to try that one.
I'm a great advocate. Michelle, you don't need to lose any weight. You're looking very well to me. Are you on it now, aren't you?
Thank you.
Yes. How long have you been on it?
10 weeks. 10 weeks now. I've
Feeling
been
the
going on
benefit?
Very much so.
It's a combination of all the things that, you know, Nick said then, is it?